Your smile is the first thing people notice. Make sure it looks its best.
Brush for 2 full minutes to adequately clean your teeth and reduce plaque.
And chew on this. If you don't floss, you're neglecting 40% of each tooth. Irritation of the gums is a leading cause of inflammation in your body.
Healthy teeth are not just about your looks. Plaque in your mouth can indicate plaque in your arteries.
And that's a leading cause of heart disease, stroke, even impotence.
So protect your pearly whites. It'll keep you being beautiful.
I'm Dr. Mike Roizen.
And I'm Dr. Mehmet Oz. Your teeth, in addition to helping with a wide range of tasks and with chewing, are also a very clear marker of your health. If your gums are inflamed, your teeth are falling out, or your teeth are getting rounded like fresh pepper from wear and tear, then these problems can affect and reflect the health and beauty of your entire body.
As part of your smile, your teeth serve as one of the main markers of your beauty. Together, your teeth and mouth act as a stage. You want that stage to be bright, white, and well lit. Though there's no direct correlation, the common perception is that our oral appearance is linked to our cerebral powers. How? Studies show that we equate snow white teeth with high-powered brains. So take a quick look at your own teeth in a mirror.
Are the tops of your bottom incisor teeth and the bottoms of your top teeth flat or somewhat jagged and yellow with some brown spots? If they're flat, that indicates that you could be a tooth grinder,
putting you at even greater risk for wearing down, breaking, or splitting your teeth and leading to gum and mouth problems as you age. Not to mention looking like a jack-o'-lantern. Mouth guards may be made by your dentist and can prevent nighttime grinding that accelerates this process. Your jaw should also be level. How can you tell? Take a double-wide popsicle stick and bite on it. Your jaw is symmetrical, the stick will tilt, an observation that should interest your dentist. Now let's take a look at your jawbone. The human jaw is a powerful little clamp exerting 50 to 250 pounds per square inch of pressure during chewing. It's extremely efficient. It's the only joint in the body that purposely dislocates itself during motion, using 2 points of attachment, a lever point in the back of the jaw and another 2 inches in front. Every time you chew, your jaw dislocates in order for you to crush food so you can swallow and digest. But the muscles that move the jaw and the temporomandibular joint can also be a sign of pain. Yes, if you chew too much or subconsciously crush your jaw during stressful times, your jaw muscles can spasm. Stress-inducing clenching or grinding can cause slight misalignment of the jaw, leading to jaw, neck, eye pain, as well as jackhammer-like headaches. A great way to relax this joint is to place a cork between your teeth and relax your jaw like this. By the way, if you lose your teeth, be it through decay or an errant baseball, your jawbone will eventually erode away as well. Use it or lose it. The only purpose of your jawbone is to support teeth in a very intricate and complicated set of muscles, ligaments, and skin hold your jaw in place. And finally, let's discuss your gums when plaque, that sticky gunk made up of bacteria and saliva, and yesterday's dinner wedges between your teeth and into your gums. It triggers a process of inflammation that leads to periodontal disease. Take a look at this animation to really bring this alive.
So let's pan in from the side of your mouth and look at these teeth. If you look at the gums and how they hold the teeth in place, you'll notice that if you get inflammation, which is gingivitis, the gums actually erode away. They pull away from the teeth. So without that cement anchoring the teeth, they can actually loosen and come out. In fact, that's the major cause of tooth loss. It's not cavities, it's gingivitis. And if you look at what happens at the side of a tooth when you begin to develop a cavity, especially if you've got eroded gums around it, the bacteria eat their way through the enamel and they penetrate the pulp, that delicate area on the inside of the tooth, and that's the pain that jets away to both sides when that happens. And so that combination of cavities and gingivitis can destroy the way you feel inside your mouth.
Here are a few tips to prevent both gum infections and cavities. 1. Brush for 2 minutes using a soft brush and rub the bristles up towards the gums so you can see and get to the actual cusps and gum. When should we change our toothbrush?
Every 2 months. And those newfangled ultrasonic brushes have about 30,000 brush strokes a minute compared to about 5,000 for typical electric ones. And they spray into the crevices of teeth to clean beyond where the tips of the bristles actually touch. In other words, they're more effective at dislodging plaque.
Get between the cracks. Despite pleading from dentists and doctors and from people who notice that ill-placed broccoli for it, 80% of us still don't floss. When you don't floss, you're not cleaning 40% of the tooth. Dentists consider flossing even more crucial for preventing tooth decay and periodontal disease than brushing. Now, if you don't floss, at least remember to save up the money to buy the dentures you're eventually going to need, as well as the coronary artery bypass graft, Viagra, and Botox, since gum disease says a lot about how you look and about the inner health of your arteries.
And finally, be smart. Employ some anti-staining techniques. Certain foods will stain your teeth as easily as a new puppy will stain the carpet. The culprits include red wine, coffee, tea, blueberries, soy sauce, and grape and cranberry juice. Now, we don't want you to avoid these foods because of their obvious health benefits, but swish with water afterwards and keep teeth whitening foods around. And these include things like apples and celery and carrots. With these simple steps, your healthier gums and teeth will pay you back with less inflammation and less dental bills.